Good afternoon, everybody. It's nice to have you here. My name is Karen Niedermeyer. I'm the Business Development Consultant in the Northeast. I know I didn't say who was on here today. It's a surprise. Hopefully, it's an okay surprise for most of you that I'll be doing today's session. So we're talking about fee-for-service today, and this is about Therap documentation and billing and how it's really configured to capture this payment model. We are going to kind of go through fee-for-service first. So there's a good list of you who are on here today who are from states that are not fee-for-service, and there's some that have been doing fee-for-service for many years. So I am going to talk a little bit about what it is, what the pros and cons of it are, and what it means, and then I'm going to kind of show you what it looks like in a Therap. This will be recorded so that we can, if somebody was unable to attend, we'll do that. But also, if you have any questions, feel free to write them in the window. I'm happy to answer questions as they pop up. So again, for some of you, this is going to be a little back to the beginning for you because we're going to talk about what fee-for-service is. But I think it's important with the group that we have on here today. So again, my name's Karen, and I'm actually worked in a state that was a fee-for-service state for more than 15 years, so I'm well aware of what that means. So I'm happy to answer your questions. So fee-for-service is just a payment model where services are unbundled or paid for separately. That's probably the easiest thing that means. It means that instead of just getting like in a contract state or depending on how your state is run, instead of just saying, here's your money, provide services for the people that you support, here it is. Every service is billed separately to Medicaid and each individual, and they don't get paid till after the service is completed, and you can prove that that service is completed. So that is the difference. So instead of you getting, here's your money for all the things you do for this person, you will get paid for each service separately. So if you run a day program, you'll be required to do things for that day program, or day habilitation service is called, and that is how you will get paid for that individual participating in that program. So that's the basics of what fee-for-service is. There's some interesting things about fee-for-service that take everybody some time to understand and kind of go from. And it's interesting for those of us who've always done fee-for-service. This is nothing new, and we're surprised when people are surprised about this. But this can be surprising to some people. So anytime the individual is not present for the service, you do not get paid for that service in fee-for-service. So while those of us who are in a state that have been fee-for-service for a long time will say, well, of course you don't get paid, they didn't go. We do understand that you still have to have staffing and facility costs, and you still incur those costs in your agency, but you don't get paid. So we're now in some contract states, or if you have that kind of system, you get paid for providing the service. In fee-for-service, you don't get paid if they're not there. The other piece of it is that each service has its own specific rate or fee, such as day habilitation, which is kind of just the easiest one for me to use because it's pretty universal. It's a day program. You have a specific rate. And usually that rate is either universal throughout the state, or there's tiers to that rate depending on, either cost of living or the individual and their needs. So they also could tier the individuals to say that this person has a higher need, so their rate is higher, and because it costs you more to provide that service. So anytime a billable service is not completed in accordance with the plan, even if the individual is there, you also don't get paid. So that's one of the biggest pieces that are frustrating, and as a provider, is if you have a room full of people for a day habilitation program If nobody takes the time to do a billable service, and we'll talk a little bit about what that means, then you still don't get paid for that service. So you spent the whole day, you did all these activities, you hopefully worked on meaningful things with those people, but if you don't record it, if it's not entered completely or correctly, then you don't get paid. So those are just some basic things that people need to understand as you do fee-for-service. Again, for those people who are in a fee-for-service state, you're probably wondering why you're on this call, because this is a reality for most of us in those states. If you are not in a place where there's fee-for-service, this may sound different and new to you. So feel free to ask questions. The billable service or the goal of the individual must be specific and measurable. So this could be about 7 different webinars and classes on its own. And we do have plenty of things on person-centered planning and writing goals that I hope that you'll look at. Excuse me, and we're not the only one that has that information. There's plenty of information out there on this. But you have to have a goal that you can actually work on. The goal can't be that they want to be a better person, or that they want to be happy. Like, that is not something that's measurable or specific. You can't measure that without a lot of work. So you need something that is a goal or a task or something to work on, a support to work on with the individual, so that they can understand, so that we can show that we actually did something with that person to work on their goals. So why? It's a good question. I'm going to do why not next as well. So why do people switch to this system? People use fee-for-service because it's supposed to increase your flexibility and consistency and the quality and provision of services. So the reason it's supposed to increase your flexibility is because before everything was comprehensive, if I was receiving supports, you definitely just receive the supports that are given to you. You live in the house, you go to the day program, they get paid for those things. In a fee-for-service system, you can decide what you want. You may say, I want to do day habilitation. I don't need, I need a community res hab or a in-home support. I don't need a residential setting. You decide more on consistent, flexibility in that way. For consistency's sake, it means that everybody's following the same rules on what it means to provide that service. The day programs have to be a specific length and time. Certain things have to happen during that day or that time. Same with in-home supports in order to get paid. Also, by eliminating that contract, they're trying to provide more freedom of choice for the individual. They expect that individuals with very specific or uncommon needs will have more flexibility and freedom in finding services that will best meet their needs. And I kind of went over that a little bit. So you have that freedom of choice. You can go to different places. You can go to one agency for one thing and one for another, and it makes it a lot easier. It's also intended in a lot of cases, and this isn't true for everybody, but for most cases, to bring in more Medicaid dollars, because if you're following the CMS rules, the Center for Medicaid Standard rules, they'll match your dollars at the state level, so it's from the federal level. So a lot of it has to do with the money, as we know, that if you are in a contract state, you're not getting as much money from the government, you're not getting as much money federally, because you're not doing those CMS standards, and it can provide based on those Medicaid rules. Why not? So why are some of you on this call who are wondering why you're here and wondering why your state is either switching to fee-for-service and why are they not? This is really focused on specific Medicaid-approved services rather than on a comprehensive lifespan support. So this is really very specific services. It's like you have a bucket of services and you pick and choose which services. It's not looking at the whole person and saying what are their needs across the lifespan. It's just saying what is their moment right now that they need. and what can we do with the services, the Medicaid waiver service that we have. Support coordination, which is or case management or whatever you call it, is a huge part of a fee-for-service, and it's really what's responsible for facilitating all these Medicaid-approved services. But they don't do anything, or they don't spend as much time on coordinating services that don't have anything to do with Medicaid. So if it's not a Medicaid service or a program, then it's not really something that they are looking at. So instead of looking, again, at that whole person, the support coordinator or case manager is really just looking at those Medicaid services. Fee for service in its basic structure is focused on volume of service rather than quality. If you think about it, some people and you know what, all of these are arguments in both directions, but really fee for service is just you have to provide a number of support, and you get paid for those number of support. While there will be audits and they will be looking at quality, in those audits, really, if you don't actually have the service done, it won't count. So really, in its basic structure, it's just the number of services you've completed. So in the last several years, there's been a shift away from fee-for-service towards value-based payment, which is an entirely other webinar or conversation that I'm happy to have at any time if anyone's interested. But that is supposed to be more on rewarding efficiency and patient outcomes rather than the volume of services provided. So that's kind of the next shift after fee-for-service. But usually most states don't go from having contracts to all of a sudden value-based payments is an option. They go to fee-for-service first and then start thinking about whether or not they can look at those measurable goals that we talked about for a minute and provide service based on that. Speaking of, so there's two huge components to fee-for-service that kind of come up that aren't really part of your world, from going from a contract to going to fee-for-service. And the first one is about goals. The second one is about auditing and reviewing. And so I'm not going to spend too much time on either of those two things because, again, both of those things are in themselves kind of their own topic. If you're interested in learning more about them, I do a bunch of webinar and information on auditing. I'm happy to share with you. And then we do have staff members who spend a lot of time talking about goals. But in order for you to have fee-for-service in order for fee-for-service to work and for you to have a billable service, you have to have a goal and what we call, and this is not our term, SMART goals. So those goals have to be specific. Who's involved? What did you accomplish? Where will it be done? They have to be measurable. You have to be able to track them. They have to be somewhat attainable or achievable. A big goal of someone could be something that's, a little bit out there, but the actual goals or staff actions or supports that you're working on need to be measurable and attainable and achievable. They have to be relevant and they have to be timely. You will complete this by this day, by this month. It says it will establish a sense of urgency and prompt you to have better time management. So you have to be able to write and have good goals in fee-for-service. Part of that is looking at, in our ISP programs, is looking at your scoring method, as well as looking at just the ISP programs in general. So when you're looking at your scoring methods, and I know it's kind of a jump, but it has to do with those goals, you have to think about what do you want to track? Do you need different scoring methods for different departments? What do you want to record but have not included in performance percentages? Who's responsible for creating this? All of this stuff is important when you're talking about the ISP program. You want to make sure that you are tracking in the ISP program everything that you need to achieve those goals. Because in fee-for-service, again, if you didn't write it down, it didn't happen, and you don't get paid. So what do you want to track? Make sure that all that stuff is in there. You can add scoring options that are not applicable or declined, depending on your state and what those are. Sometimes declined or refused is still an acceptable answer. It just depends on the regulation, because everybody has their own twist on the CMS guidelines. So again, the major fee-for-service tool is that ISP program or ISP program templates. Before I talk about the other fee-for-service tools, which I will talk about, I promise I'll bring that back over. I do want to just say, and I don't have a slide on it, that the other piece about SMART goals or doing their goals and looking at your scoring method is the auditing piece of fee-for-service. So what happens after everyone starts fee-for-service and things start to move along is that the state realizes or that they need to review everything to make sure that you're doing it the right way. So these audits are kind of the next step. So in states where you are longtime fee-for-service folks, you are very used to auditors showing up and going through your paperwork. What they do is they show up with certain Medicaid standards. They show up with their Medicaid standards, and they show up with knowing which days you billed for. And they want to see all the backup for that day. So they want to see, on this day, at this hour, you billed for this person. So they want to see all the documentation and make sure it's correct. So of the two things for fee-for-service that you really need to work on, that I think that we see the most, and I know over my years of experience have seen the thing that needs to be worked on the most is, you know, having some sort of internal auditing system so that, and policies in place so that you know what those rules are and that you're watching for them, so you know where your weak links are and what you need help with and how to meet those goals. And then the other part is those goals and making sure that you are having SMART goals, that they're achievable, that they're measurable, and all of that. So those are the two areas in fee-for-service that are really the big changes that you're not used to, but will become used to very quickly. So now I'm going to show you some of the other areas in Therap, and I'm just going to show you a couple things. I know it's only 1:20, and I will be honest and tell you that I didn't know I was teaching this right away, so I don't think we're going to be here for a full hour, but for Friday afternoon, we will get done what we need to, and you can ask the questions you'd like to. So the first thing we just talked about was those ISP programs. Those are your huge tool for doing that, for making those goals. Make sure that the task is the actual support or the goal. When you're doing that, make sure you understand how your state has that set up. What are you getting paid for? Are you getting paid for the staff action, what the staff is doing, or are you getting paid for what the individual is doing? You know, what is the thing that you're getting paid for? So you really need to know that piece. So those are excuse me, those are important things for you to kind of put in there. Okay. Let's see. I'm just making sure there's no questions. It looks like we're doing all right. So those ISP programs. The other piece of ISP programs that you should know about are making sure that you know about ISP program templates or the template library, as well as the global template library. Because sometimes you will have people who have a hard time being able to be part of and understanding how to, just a second. Okay. We're good now. Sorry, I had a bot doing some things. All good. All right, we are back at it. So if something to just be aware of is to remember that in fee for services, those are those goals. But you're going to have staff other people who write those goals. It's not just you, and that makes it difficult to do things for a lot of us who are very particular about what they should look like. A nice way to set that up is setting up ISP program templates, which you would know. You're just going in and clicking new on those templates, and you're filling out a lot of this information. You can also put in a scoring method. You can put in tasks. You can set up goals and services that are more generic. Now remember that things need to be person-centered, and so you really do want to keep that quality in play the best you can in the fee-for-service system, because it's really up to you to do that quality in this kind of a system. You want to make sure that you have all of those things filled out, but you want to again make sure that it's in a person-centered way. You can now put in tasks that are very generic to kind of get people started. So you can make an ISP program template for a service, so that partly so that they also understand what type of service it is. So that's an important piece of it. So you can have people use those templates. I'll let you know there are lots of templates in the template library for you to use as well. There's a lot of people who really do understand those different services. And when we say different services, we mean the CMS rule services that are used, those Medicaid waiver services. And what all waiver means, for those who are wondering, is that if the regular Medicaid rules have been waived, so that these services can also be included Medicaid dollars. That's all that it means. So that's what we're kind of talking about in this kind of instance. So you want to set up some templates, or at least teach people the differences between the different types of services. So that's a big area to kind of a tool for you, I guess, to use. Now I'm going to go through a couple of tools for you to look at in billing and admin. I promise I won't get too involved. It's also better that I'm showing you this, because if Marie or Heather or Nadine or any of them were showing you this, you know that it would be much more in-depth and confusing for those of us who are not billing people. So I just want to show you, especially if you don't do this at your agency, some of the ways, the tools that Therap uses for that, to show you what is going on behind the scenes for fee-for-service. So attendance type is one of the biggest areas. And I'm going to stick with the day hab example and show you that you'll see, depending on the different attendance types, that there's these bundle rules or different rules. So all of this is put in place in the background in your fee-for-service, depending on what your rules are. So if your rules are you need 4 hours a day and you need 2 services, we can say that between 240 minutes, between this many minutes, you'll get a billable unit if there's 2 services. And that makes a full day. You can do a half day. You can do all kinds of things within the service. It'll also bundle that time throughout the day, which is another area. But this is just to show you that in these attendance types is one of the starts to how these tools work. So you can see we have present, absent, holiday, and all these other things, but the only one that's billable is that present. And making sure that you have those services in there for fee-for-service. So without that, attendance type and those bundling, you don't get to see that. So that's an important one. Another area is that description code. So we'll pull up a description code, and we're going to still stick with day hab. But we're going to see the description code is the unit is day, and you can put in the different codes and everything. But this area is not used in day hab, obviously, because it's by hours. But this is another area that is a unit calculation that's important for billable services. You can see we have across the country all of these different quarter up, 2/3 down, 3/4 up. What that means is If you have a service that's billed by the hour, or it's called an hourly service, in some states that hourly service is by 15 minutes, sometimes it's by 60, sometimes it's by longer than 20 minutes. So it's always different. Sometimes if it's a 15-minute increment, which is fine, and I will have to remember not to update this, but if it's a 15-minute increment, they have to then decide if there's only 8 minutes, do they still get paid? And in some states you do, because it rounds half up. And some states you don't, because it always rounds half down, or it rounds down. So all of these rules kind of go through and make it qualified whether or not it works in fee-for-service. So in Therap, all of this is in the background and important for services to kind of keep going. Those description codes are important. Here's a community service one, so this one is 15 minutes and down. And that's a New York one. I'm in a New York demo account. So that means in New York, to get a unit, you have to have 15 minutes of service. If there's 14 minutes of service, then you don't get paid. And that's an important, discrepancy. In some states, it's 2/3 up and 2/3 down. It really just depends on that. You'll also see down here, there's definitely some other areas that help us out when we're looking at fee-for-service. And this is, again, all stuff that's set up in the background. This is not stuff that you need to know on a regular basis, but like, for instance, the unit calculation rule. What this means is that if you have a care-at-home service, or a service, a respite service, or an individual support service, it bundles all the time for the entire day. You may have to set this up to apply that rounding algorithm and then bundle it up, time in and out for all day. Because if someone is seen for 12 minutes in the morning and 3 minutes in the afternoon, then they still get that full 15 minutes. So that's part of another fee-for-service kind of piece to it, which I know sounds maybe a little further than people were looking for today, but I wanted to kind of show you some of those areas. So I still have no questions, which is crazy, because we're halfway through, well, probably more than halfway through. So next I'm going to just show you a few more reports, and we'll be just finishing up kind of today after that. But again, the important thing to understand in fee-for-service is that so much of what you have to know is already set up in the background, and our billing specialists will help you set those things up. If you live in a fee-for-service state and you're not using any billing software, if you're not using us for billing, even if it's just for the calculations, I think it can be very frustrating. From someone who did it for many years, there's a lot of pivot tables and Excel involved with trying to figure out unit calculations if you're not using some sort of billing through us. And that's just my plug for today. I know you can do it. I did it for many years, but it is a lot easier when you're able to do those calculations right within Therap. So just a couple of reports that will show you those fee-for-service things. I'm not going to get too far into billing, but I will show you that you can pull an easy summary at any time, a billing data summary. Excuse me. This at all. So when you pull up all of these billing data summaries, you're going to see the services that were provided, but you're also going to see, the dates that they were provided and all of the unit information. And I think that's the important piece that people want to see: the type of unit, what the unit rate is, remaining units, total units, amount billed. All of that information kind of goes right across. So it's important information for you after you've billed to have available for that fee-for-service. This is the kind of data that auditors are pulling up on their end, because they're pulling it up from Medicaid. So they're showing up and saying that on this day, Nora Starr had community HAB, and this is how much she had, and you billed eMedNey this much. And so we need to see all of the backup for that. We need to see that on 8/31, You know, it was 15-minute increments, and you did 20, 21 was great, and you did 10 billable units. We want to see the backup for that. So we want to see your documentation. We want to see any summaries you've written about it. But that's the information that an auditor has in a fee-for-service world, is they have specific claims that fee-for-service claims, and they want to see how you got there. So that billing summary is one way to look at that information. Another great report is just a utilization report. I'm just going to pull it for an individual. What this pulls is is hopefully something. Oh, I even checked this ahead of time, I promise. Oh well. What this will pull is a report that, an Excel report that will show you what services that the person has, what that unit is, but it's by individual. I was going to show you, not by program. So if you want to pull it up by one person or just audit one person, you can do so. You're not necessarily looking at all the units or all of the areas. You're just looking at one person and what they've received and making sure that all of your stuff is in line. Some good things to remember when you're looking at fee-for-service is make sure you understand the rules of what can and can't be done on the same day, what can and can't be overlapped in terms of services. If you're receiving one service, are you allowed to receive another service? Sometimes that's an important one. If you're receiving, residential placement, can you also receive in-home support? If you are receiving day habilitation in a day, how much vocational can you receive? Can you receive them at the same time? All that information is really important. We have a number of reports that will show you some overlapping as well. In attendance, we have time range overlapping across multiple services and multiple programs. Those are important. You can also do audits on your entries because that's something in fee-for-service. Is not only do they want you to make sure you put in documentation, they want that documentation to be done in a timely fashion. And depending on where you are, how timely that has to be. So, for instance, we have some reports down here in attendance and in ISP data that will tell you how late that information was put in. So it's another kind of audit point that you can look at. Yes, you have to decide, or the state decides what that means when they say timely. But what they're saying is you can't put it all in at the end of the month for the whole month. You have to, spend some time and put that in on a regular basis, depending on the state and the rules of your regulation. So we have a lot of, not only do we have that backup in billing, but in our report library, we have plenty of tools for you to use to check on your fee-for-service and to see what you need to have done. And so that's really what I had planned to go through today. I know that was just half an hour, but I didn't want to overwhelm you. And I know that most of what we talk about when we talk about fee-for-service is talking about either doing a billing demonstration or talking about goals and services or talking about auditing. And I think those are very big topics. So what we have is we have already have some webinars on all three of those areas for you to kind of look at and decide if there's something that you need more information on. I'm hoping that if you need more information on fee-for-service in general, if you're interested in learning more about what other states have or what is happening around the country, please let me know. You're welcome to email me and let me know. But I will say that it can be very helpful to find out what's happening in other states. So if you're interested and you want more information, feel free to let me know. This webinar was recorded. It will be put on the website at some point, so you'll be able to see that. And I hope to hear from you all soon, and hopefully see some of you at the national conference in a couple weeks. Thank you. Have a great day.